Hello, good evening. My name is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. I hope you had a wonderful Tuesday and you were able to accomplish a lot. Our clinic this evening is going to be very interesting, especially if lately you've been wondering if it's all over for you regarding starting your family. So today we're going to discuss the near impossible to an unaided eye, but something that can still happen. So this evening, we're going to look at the possibility of pregnancy in a woman that is 60 years and above. So what are the three ways a woman that has reached 60 and above, what are the three ways she can use to succeed in becoming pregnant and ultimately becoming a mother? I know it's a tough one. I know some people might be thinking, is she crazy? But here's the deal. It's possible, but it carries a lot of risk factors. So what we're going to do today is to look at the three possible ways a woman in her 60 and above can achieve pregnancy. Three ways, three proven ways. So if you're going to participate when you join, let's know who you are. So introduce yourself. We're going to have fun. So I'm going to quickly settle in. And once we have a traction, I'm going to start. Make sure you subscribe to this channel by clicking on the notification. And make sure you know when we normally come live. Tuesdays, 6:30 p.m. Eastern Time US, which is about your 11:30 p.m. in Nigeria. And immediately after this, I'm going to go to Facebook. We're going to spend another 20 minutes and we're going to go for the day. So I hope you had a wonderful day and we're going to start. You see, pregnancy is a beautiful thing. The life of a mother is a blessing. Women are blessings, but women are programmed. So you see a flower in the morning. When you wake up in the morning, like sunflower or all those beautiful flowers that bear, fruits, you will see them, they will blossom, they will be so beautiful. Now, if you monitor them towards afternoon, they will start losing their glamour, they will start losing their shine. Then at the heat of the afternoon, you will see them start withering. Then towards evening, you will see some of them pretty much beat up. That's exactly how the life of a woman is. Women are programmed from birth. The moment we confirm you have XY chromosome, you're a man. So the Y chromosome is what will give you a kind of immunity. But once you have that XX chromosome, something unique happens inside the body of a woman carrying a baby girl. All the eggs she will use to start her family, they are already programmed in the ovaries. So if you have a baby girl growing in your womb right now, inside her, your baby girl's body is developing her own sets of eggs she will use to start her own family. Now, by the time she's coming out of your body as a baby girl, immediately she comes out of your body, immediately she gets exposed to the environment, there are already changes that happen in her body. Now, every year and every milestone, she will be losing a lot of those eggs. So while in the mother's womb, she will have pretty much millions of eggs. From those millions of eggs, by the time she gets to the childbearing age, she will probably will be left with a couple of thousands, couple of multiple thousands. Then every month, she'll be releasing the eggs through the process of ovulation. If pregnancy happens, then the other eggs will wait. But if pregnancy doesn't happen, it's expected at the 12 months of the year that a woman would have released 12 eggs. So as a woman is aging, her eggs are also aging. So this is something you need to understand today. A woman will not always be fertile for the rest of her life. A woman will start, run through all her lifespan, then go into retirement. When you go into retirement, you no longer have eggs. When you no longer have eggs, possibility of pregnancy, it's not there naturally, but it's there with help. So the very first step A woman that is currently 60 who must meet some criteria. There are some personal, there are some medical, there are some social and family history criteria you have to meet, because at 60, pregnancy at 60 carries a lot of risk factors. Remember, pregnancy is not all about, oh, I want to get pregnant. We have to make sure that your baby is also going to be healthy. There are so many risk factors you will have once you get to 35 years and above and you want to become pregnant and you want to become a mother. So imagine 60. So there are so many risk factors. But if you genuinely, for whatever reason, for whatever sake, you want to become a mother and you want to see if you can maximize your few chances of becoming pregnant at age 60, number one approach is assisted reproductive technique. Assisted reproductive technique is coming in regards to this because by 60, by all stretch of imaginations, you might have likely gone into menopause. Now, if you have any remnant of eggs, possibility that 99.9% they are not of good quality is there. So number one option, which is workable for a woman that want to get pregnant at 60 is what? Assisted reproductive technique using IVF, in vitro fertilization with donor eggs, and possibly donor sperm. That's number one proven way she can become pregnant. So if we check our parameters, if we check our hormones, or if we can control her hormones, if we can control her body, if we can control the thickness of the endometrium, we're giving her some hormonal drugs. If we are okay that this woman doesn't have any chronic medical problems like diabetes, like hypertension, like heart problems, like other things that can complicate her pregnancy, we are only sure that the only thing she wants now is to have a baby. Once she gets a pass, we are going to work her up by giving her a couple of hormonal-related drugs to make sure that the thickness of the endometrium is enough to support pregnancy. Once we are sure that she has good endometrial coverage, then we're going to use donor eggs. Now, those donor eggs must be from a younger lady, generally from 25 to above 30 or 32. The younger a lady is, the better regarding the donation of eggs. So that's number one. So we collect the donor eggs. We collect her partner's sperm. If her partner's sperm is good, we can use that. If her partner's sperm is not good, then we can also use donor eggs, donor sperm. Now, when we use that donor egg and donor sperm, it's going to be outside the body of the woman. By the time everything is all said and done, we're going to transfer it back to her body. So this is number one. This works in a place that you can monitor the lady properly and make sure there is no complications. So that's number one. Number two is also workable in developed countries. So for this lady at 60, it's possible she froze her eggs very early in life. So if you live in resource-rich country and you know for some reasons you're going to go to medical school, you're going to go through a lot of academic works, and you are not ready to start your family, maybe in the next 20 years, maybe in the next 10 years, and you are nearing your 30s. If you have the facilities in your late 20s, go and freeze your eggs. So the second option for this lady, it's frozen eggs. So if this lady at 60 froze her eggs, at 20 or 25 or early 30s, we can go back and use that egg she froze at age 20 or age 30, and the eggs will be exactly in the same state when that egg was collected. So the second option is what? Using your previously frozen eggs. That's the second option. Whatever I'm telling you now is not tales by moonlight. It's something that has worked in developed countries. So a 60-year-old woman, besides using donor eggs, can use her previously frozen eggs. So long as this lady is in good health, so long as she doesn't have complicated hypertension, so long as she has good BMI, so long as she's healthy and she doesn't have uncontrolled diabetes, we can comfortably use that eggs she froze when she was 25, she froze when she was 30, and we can now use that eggs to start her family. The only thing we're going to do is to make sure that the cover of her womb is also healthy. Now, the final way this lady can also become a mother is to go through surrogacy. When she's going through surrogacy, is an agreement between three parties. the mother-to-be, the surrogate mother, and the father-to-be. The surrogate mother is a vehicle that will carry their babies. This is a legally done process. 3 people will come together, understand each other, have a memorandum of understanding, then go about making babies. The woman that will carry the baby in her womb for the 9 months is called the surrogate mother. The parents of the baby will play their own role, and when the baby is born, the baby will become the baby of the 2 parents that wanted to have that. So that's another option. Surrogacy is an act of love. Surrogacy, it's okay legally to go for. There are 2 types of surrogacy: traditional surrogacy and gestational surrogacy. I'm not going to go into the details, but just know that this lady also has the option of surrogacy. In a surrogacy situation, a mother, a younger mother, will come and be the vehicle that will give birth to your baby. Then once your baby or your babies are born, your babies will be all your baby just by yourself. So these are the 3 important ways a woman in her 60s can succeed in becoming pregnant and becoming a mother. But like I told you, just know that it's a very risky venture. So you have to be very ultra careful. Immediately we've done everything we are supposed to do, we have to watch you closely. You have to register for your ANC immediately. We have to be giving you frequent appointments because there are so many risk factors you will develop. Possibility that baby is going to come early is there. Possibility we're going to go through cesarean section is there. Possibility you develop miscarriage is there. Possibility you have chromosomal abnormality is there. Possibility you have Down syndrome is there. So there are so many possibilities. So we're going to monitor you from day 1 until you have your baby. There is a possibility. Matter of fact, any mother that gets to age 35 and above is classified as advanced in maternal age. For the singular reason that we want to monitor you, make sure that everything is okay before we can say, you know what, you're good to go. So pregnancy and motherhood is still possible. Now, the final process that will make this woman a mother, not necessarily pregnant to become a mother, is adoption. And adoption is on the table too. So she actually has 4 options: going for donor egg, donor sperm option, using her previously frozen eggs, going for surrogacy, and going for adoption. These are the 4 ways this lady can also be called a mother. So if you have such interest, go and have meaningful conversation with your provider. And if they need to refer you to a fertility specialist, they can refer you to a fertility specialist and you can begin your journey. There is a possibility that at age 60, you can still be a mother of your own baby. Previously, a couple of years ago in Nigeria, a 65-year-old lady succeeded in becoming pregnant with donor egg in Nigeria. I think the oldest mother is an Indian. So it happens. But there are so many things we need to be on the lookout for. It has to be a well-planned process, and we have to mitigate on any medical problems you might have, both acutely and on a long-term basis. There is a possibility. In medical practice, there are a few words we don't use. We don't use always and we don't use never. Anything is possible and anything is impossible in medical field. We always want to go in the middle. So we don't use never, we don't use always. This is my presentation. At this stage, I'm going to give you an opportunity to ask me questions. So I'm going to collapse the clinic now. It's time for questions. Please feel free and ask me any questions you feel you might benefit from. Okay, thank you so much, COO. I know you have a lot of questions waiting for me, so I can't wait to hear your questions. Tosi, how are you? Thank you so much for coming. So it looks like those of you are it looks like you and Tosi are the only people in the clinic today. And it's quite an encouraging one because these are 2 powerful ladies. So COO, Tosi, please go ahead and ask your questions so we can go and get ready for Facebook. No, every country, every continent. Matter of fact, let me use the first one. Even in Nigeria, a couple of months back when we were having our normal masterclass, the guest presenter in our masterclass told us actually that they've had a couple of modifications in IVF policies in Nigeria. So each country will have their own guiding principles. So before you embark on any assisted reproductive technique, this is an area I'm going to warn so many people. For example, if you live in a particular country and you're planning to go to another country, even a continent. So for example, if you live in North American continent, which is America, and you're planning to go to Africa or whatever part of Africa, Africa is a very big place, East Africa, North Africa, West Africa, Central Africa, you have to study the guidelines. You have to understand the guiding principle in the place you're going to and in the place you're living. We've had cases of people that went to Nigeria, went through adoption, went through surrogacy, went through a couple of other advanced way of starting their families. And because of some legal loopholes, they couldn't travel back with their baby. So before you go doing anything, make sure you understand the rules which are pertinent in the place you're living, which is most important. It will not make sense to go and adopt a baby in Nigeria and the continent or the state or the country you live in will not allow you to bring that baby easily. It doesn't make sense. It defeats the aim. So each country will have their guiding principles regarding the upper limit. There are some countries that will not encourage women above 50s to go for IVF. There are countries that will not allow more than one egg to be transferred or more than 2 embryos to be transferred. So whatever is applicable in your country, please make sure you study them. If you're living in developed countries and you want to go to if you're living in developed countries and you want to go to developing countries to go for any baby process, please make sure you understand what's applicable to your own country. So for example, if you're going to move from America to Nigeria for anything, make sure you understand the rules and regulations in America. Make sure you understand the rules and regulations in your state. Make sure you understand the rules and regulations in your county, in your city, because from the federal level to state level to county level, they might have different policies. It's important you do this. You don't just go do stuff because other people are doing it. You have to be well organized. You have to have informed decisions. You have to ask a lot of questions. So that's the situation. Very powerful question from COO. Is it possible for a woman at 60 to give birth vaginally? Yes. If the vagina is favorable, we will allow her to deliver through the vagina. But guess what? There are a couple of complications around that pelvic area, based on age and a couple of other related factors. So majority of them will go the safe way. The safe way in this regard is cesarean section. Because at that stage, there are so many things we are contending with. Of course, we're not going to allow her to get to 42 weeks. Possibility we're going to be targeting delivering her around 37 weeks is very high. So the most likely portal of delivery will be CS. But some women that qualify for trial of labor can also go through labor. I love these two very technical questions from Tosi and COO. Great job, guys. Do we have any other question, please? Okay, so COO, what we're going to do, it's currently 18 minutes. So once it gets to 20 minutes, we're going to transition. Can taking IVF treatment medications increase the risk of cancer in advanced age women? Yes, it can. So remember that cancer is a very complex disease. So there are a couple of other carcinogens that these women might be exposed. They might have some cancer genes. Their body weight might predispose them to cancer. Their environment might predispose them to cancer. So the older you are, the more the possibility you're going to develop cancer. So if we now expose you to exogenous hormonal drugs, they will make it easier for you to develop cancer. So the answer is yes. So when you compare a 20-year-old lady to a 60-year-old lady, a 60-year-old lady will have a higher risk factor of developing cancer compared to a younger lady. Now, if you already have carcinogens, if you already have cancer risk, and we are introducing exogenous hormones, which you are going to use if we're going for IVF, then your risk factor and your risk profile will be up. Classically. So the answer is yes. The older you are, the more the probability you're going to develop cancer. Cancer can develop at any stage in your life, but you have more risk factors as you live more in the world because you're going to be eating a lot of carcinogens. You're going to be inhaling a lot of things in the environment. You're going to be exposing yourself due to your personal behavior, your habits. So the possibility of developing cancer is higher in elderly women. So the answer is yes. I love all these questions. Wow, where did you guys get these questions from? Can a woman of 60 years experience a shortened cervix during pregnancy? Yes. Matter of fact, the possibility she will have problems in the cervix will be high just by the same factor I'm mentioning, because one of the things that will happen as you're aging as a woman is reduction in the level of your estrogen. So when your estrogen is reduced, the elasticity in your body will reduce. The probability for your body to function appropriately will reduce. So a woman in her 60s, probability that she'll be experiencing dry vagina and the level of estrogen is low is very high. So there are a couple of things that can also go wrong. So the answer is yes. Okay, so guys, we've come to the end of the clinic today. My next clinic in YouTube will be on Saturday, and it's going to be 3:30 p.m. Eastern Time US, which will be your 8:30 p.m. in Nigeria. But right now, if you are in our Facebook group, please hop into our Facebook page and group, and we'll continue the conversation. We're going to have exactly the same presentation. But CO, thank you so much for coming. Tosi, thank you so much for coming. I hope both of you learned one or few things today, and I hope to be back again. But until I see you guys, God bless you and enjoy the rest of your evening. Bye-bye for now.